We think it's spreading so rapidly because it has adapted very nicely to the human respiratory tract and can grow and replicate more rapidly than many of the other viruses.
So given, what you know of this virus so far and, from your studies, how does that change the way we need to protect ourselves?
Okay, so what we're looking at is to see whether or not this virus can grow in both the respiratory tract and also in the gut, because that will have a big impact on how we should manage the control of this virus to stopping it spread from person to person.
You've been studying viruses for years. How is this virus different from anything that you've ever studied before?
It's actually not too dissimilar, is that it's a virus which has some similarity to some of the influenza virus which we've been studied in the past, in the way in which it can grow and in the sites of the body in which it can grow.
There's just so many information coming out left, right, and center. How does a task like this you coordinate all together for the best outcome?
Yeah, you ask a very important question. Is that what we're doing is we're working with normal human tissues, because we have to make sure that what we find is not just confined to laboratory cell lines, but that applying it to the human situation. So our findings will be very important to be helping organizations, governments and organizations about how to stop this virus from spreading.
Now, so each year we have new influenza vaccines, but given how little we do currently know about the coronavirus, can we expect a vaccine for the virus anytime soon?
Definitely not, because unlike television, where people have a vaccine and then small container, then 2 days later it's it's going to the whole world. Vaccine production takes a much longer period of time. You have to make sure it works. You have to make sure it's safe, and then you have to make sure it doesn't have any side effects, and that sort of thing can take years, not days or months. I think people shouldn't be misled by Hollywood and on these sorts of things.
A vaccine wouldn't be any use to those already infected by the virus already, would it?
Definitely not. The vaccine is only good for the prevention of normal people from getting infected. So, even when there was the swine flu outbreak in 2009, by the time a vaccine was available, already half the population had been exposed. So I think the reality is that we will not be able to get any vaccine available until this current outbreak is completed.
What sort of treatment options offer the best hope for those already infected?
So what's being tried right now are antivirals, which have been used for HIV and for some of the hepatitis viruses, which are able to stop the virus replicating. But the problem is that there are many different types of viruses, and not all respond equally to antiviral therapy. The other treatment is one which is called an interferon, which is able to dampen down the immune response to the virus. So these are both being tried. And also because we have the ability, using the cells and the tissues which we're growing in culture, to see whether or not any other agents can be useful.
So Professor Nicholls, a health expert and someone who studied viruses for a long time, especially putting so much time into Sars back in 2002, 2003, what are your main concerns?
My main concern is that on the access of information and what's going out there, because there's so many people who want quick information, and it's very difficult to actually separate out what is true from what's false. And this is where social media is actually playing both a beneficial as well as a detrimental role. People just want an answer so quickly that there's the ability to fact check it is probably not as rigorous as might be happened if there wasn't as much media concern and public anxiety.
Well, Professor Nicholls, do take your time, and thank you for your conversation today with South China Morning Post.
And thank you very much.